Are you worried about what high creatinine levels mean for your kidneys? Well, it's certainly a common and very valid concern. But the good news is there are proactive steps you can explore. You see, creatinine is a key marker for kidney function, and high levels can indeed signal impaired kidney health. Now, while no supplement offers a cure, some evidence-backed options may support kidney wellness and potentially help manage creatinine. So, today we're going to explore 6 such supplements and important considerations for their use. Number 1, vitamin B complex. First up, let's talk about vitamin B complex. A comprehensive vitamin B complex supplement could really be a cornerstone in supporting kidney health, especially for individuals who are navigating chronic kidney disease. These essential vitamins, including thiamine, riboflavin, pyridoxine, cobalamin, folic acid, niacin, pantothenic acid, and biotin, play so many multifaceted roles in our body's overall well-being. Now, for those with kidney concerns, the requirements for these water-soluble vitamins can actually change. They often increase due to dietary restrictions or losses during dialysis, and this makes supplementation a vital consideration, always under medical guidance, of course. Their collective action supports numerous bodily processes that are crucial for maintaining health when the kidneys are under stress. So, how might B vitamins benefit kidney health? Well, the potential mechanisms are quite varied and significant. One of their key roles is in helping to reduce inflammation, and inflammation is a common adversary in chronic kidney disease that can unfortunately exacerbate kidney damage over time. By modulating these inflammatory pathways, B vitamins can contribute to a more favorable internal environment for kidney function. What's more, they are indispensable for optimal cellular metabolism. This ensures that cells throughout the body, including those in the kidneys, have the energy and resources they need to function effectively. And this support for cellular processes is absolutely critical in aiding the kidney's natural detoxification and filtration capacities. Interestingly, emerging research and clinical observations have started to shed light on the positive impact of B vitamins on kidney health markers, and that includes creatinine management. Some studies suggest that certain B vitamins like folic acid, B6, and B12 can help lower homocysteine levels. Homocysteine is an amino acid that, when elevated, is associated with an increased risk of cardiovascular disease, which, as you may know, is a common comorbidity with chronic kidney disease. Now, while direct, large-scale evidence definitively linking B vitamin supplementation to significantly lowered creatinine levels is still developing, their role in supporting overall kidney function and mitigating complications like anemia and neuropathy is well recognized. This indirectly contributes to better kidney health outcomes. Now, when you're considering vitamin B complex supplementation, it's absolutely crucial to approach dosage and safety with careful consideration. Ideally, this should always be in consultation with your healthcare provider. The appropriate dosage can vary widely based on individual health status, kidney function level, and any specific deficiencies you might have. Since B vitamins are water-soluble, excessive amounts are generally excreted in urine. However, for individuals with significantly impaired kidney function, the ability to excrete excess vitamins can be compromised, and this could potentially lead to adverse effects. Therefore, a tailored approach, possibly guided by blood tests, to assess vitamin levels is really the safest and most effective way to incorporate B vitamins into your kidney care regimen. Number 2, vitamin C. Moving on to our second supplement, let's discuss vitamin C. Vitamin C, which you might also know as ascorbic acid, is widely recognized for its powerful antioxidant properties. These properties play a crucial role in protecting the body from damage caused by oxidative stress. You see, oxidative stress happens when there's an imbalance between free radicals, those are unstable molecules that can harm cells, and the antioxidants that neutralize them. This whole process is particularly relevant to kidney health because our kidneys are highly susceptible to oxidative damage. This is due to their high metabolic activity and their important role in filtering blood. Chronic kidney disease itself can unfortunately exacerbate oxidative stress, creating a kind of vicious cycle that further impairs kidney function over time. So, by bolstering the body's antioxidant defenses, vitamin C can help support overall kidney health. It works to neutralize those free radicals, potentially reducing the oxidative burden on the kidneys, and in doing so, helping to preserve their function. Now, while vitamin C isn't a direct treatment for high creatinine, its role in maintaining a healthier environment for the kidneys might indirectly contribute to more stable kidney function. And as a result, it could assist in managing creatinine levels. After all, a well-functioning kidney is much better equipped to filter waste products like creatinine from the blood effectively. However, and this is very important, you need to exercise caution with vitamin C intake, especially if you have advanced kidney disease. While it's beneficial in appropriate doses, excessively high levels of vitamin C can unfortunately lead to the formation of oxalate crystals in the kidneys. For individuals whose kidneys are already struggling, this can increase the risk of kidney stones or even further kidney damage. This is precisely why the principle of more is not always better is key here. Megadoses of vitamin C are generally discouraged for those with kidney conditions, particularly if not under strict medical supervision. When we look at clinical studies investigating the direct impact of vitamin C supplementation on creatinine levels in patients with chronic kidney disease, the results have been mixed, and more research is certainly needed to establish clear guidelines. Some research does point towards benefits in certain populations or at specific dosages, particularly in mitigating inflammation and oxidative stress, which, as we know, are underlying factors in kidney disease progression. However, the potential risks associated with high doses mean that any consideration of vitamin C supplementation, especially for those with existing kidney issues, absolutely must be discussed with a nephrologist or healthcare provider. They can help determine a safe and appropriate intake level based on your individual health needs. Number 3, omega-3 fatty acids, fish oil. All right, let's move on to number 3, omega-3 fatty acids, often found in fish oil. Omega-3 fatty acids are a type of polyunsaturated fat, and they're really renowned for their potent anti-inflammatory properties. These properties can be particularly beneficial for kidney health. The primary sources of these healthy fats include oily fish like salmon, mackerel, and sardines, which provide EPA and DHA, and plant-based sources such as flaxseed oil and walnuts, which provide ALA that the body can partially convert to EPA and DHA. Now, chronic inflammation is a key driver in the progression of kidney disease, and by helping to quell this inflammation, omega-3s can play a very supportive role in protecting kidney tissue and function. There's a growing body of evidence from scientific studies suggesting that omega-3 fatty acid supplementation can have a positive influence on several aspects of renal function. Research has indicated potential benefits in reducing proteinuria. That's the presence of excess protein in urine, a common sign of kidney damage, and also in slowing the rate of decline in glomerular filtration rate, or GFR, in some individuals with certain kidney conditions like EGA nephropathy. By mitigating inflammation and potentially improving blood lipid profiles, omega-3s contribute to a healthier cardiovascular system, which, as you might imagine, is very closely linked to kidney health. The impact of omega-3s may also extend to various metabolic markers, and these could indirectly influence creatinine levels. By reducing systemic inflammation and oxidative stress and potentially improving insulin sensitivity, these fatty acids can contribute to overall metabolic balance. So, while omega-3s might not directly target creatinine for reduction in the same way some medications do, their contribution to preserving kidney function and slowing disease progression can certainly help maintain more stable creatinine levels over the long term, reflecting better kidney health. Now, if you're considering omega-3 supplementation, like fish oil capsules, guidance on dosing and safety is really important. Dosages used in studies for kidney health do vary, but they typically range from 1 to 4 grams of combined EPA and DHA per day. It's crucial to choose high-quality supplements that are tested for purity and for contaminants like heavy metals. While generally safe for most people, high doses can sometimes cause gastrointestinal upset or interact with blood-thinning medications. So, it's essential to discuss omega-3 supplementation with your doctor to ensure it's appropriate for your specific health situation and to determine the right dosage for you. Number 4, probiotics. Coming in at number 4 are probiotics. Probiotics are live microorganisms, often referred to as good or friendly bacteria. When administered in adequate amounts, they confer a health benefit on us, the host. Their primary role is often associated with promoting a healthy gut microbiome. That's the complex community of bacteria and other microbes living in your digestive tract. A balanced gut microbiome is crucial not just for digestion, but for overall health, including immune function, and something that's increasingly recognized, kidney health. Supplementation can help restore or maintain this delicate balance, especially when it's been disrupted by diet, illness, or medications. Now, the mechanism by which improving our gut microbiota can influence creatinine metabolism and excretion is a really exciting area of research. Some gut bacteria are known to metabolize nitrogenous waste products, including urea and other compounds that can contribute to uremic toxin buildup when kidney function is impaired. So, by supporting a healthier gut environment with specific probiotic strains, it's hypothesized that the burden of these waste products on the kidneys could actually be lessened. This might happen through increased microbial metabolism of these toxins in the gut, leading to their excretion through feces rather than relying solely on kidney filtration. Research is increasingly exploring the links between probiotic supplementation, the reduction of uremic toxins, and improvements in renal markers in individuals with chronic kidney disease. Some studies have suggested that certain probiotic formulations may help lower levels of specific uremic toxins, like indoxyl sulfate and p-cresyl sulfate, which are associated with the progression of chronic kidney disease and cardiovascular complications. While direct, significant reductions in serum creatinine solely due to probiotics are still under investigation, their role in mitigating toxin load and inflammation certainly shows promise for supporting kidney patients. There are various probiotic supplements available, and they contain different strains and concentrations of bacteria. Common beneficial strains include species of Lactobacillus and Bifidobacterium. When you're choosing a supplement, it's a good idea to look for products with clinically researched strains and make sure you store them properly to maintain their viability. Probiotics are generally considered safe for most healthy individuals, but those who are severely immunocompromised or critically ill should definitely consult their healthcare provider before use. And for kidney patients, discussing with a nephrologist is very important to ensure the chosen probiotic is suitable and safe for their specific condition. Number 5, fiber supplements. Our fifth consideration is fiber supplements. The rationale for using fiber to help manage creatinine levels really centers on its significant role in supporting digestive health and its ability to promote the excretion of nitrogenous waste products. Dietary fiber, particularly soluble fiber, can bind to certain waste compounds in the gut. This includes some byproducts of protein metabolism that the kidneys would otherwise need to filter out. So, by facilitating the removal of these wastes through bowel movements, fiber can potentially lessen the excretory load on compromised kidneys. And this may indirectly reflect in more stable creatinine readings. When it comes to increasing your fiber intake, you have some excellent natural sources as well as supplemental options. The best approach is often to prioritize whole foods that are rich in fiber. Think about fruits like berries, apples, and pears, vegetables, especially leafy greens, broccoli, and carrots, legumes like beans, lentils, and chickpeas, and of course, whole grains. However, for some individuals, particularly those with dietary restrictions or increased needs, fiber supplements such as psyllium husk, inulin, or methyl cellulose can be a convenient way to boost intake and ensure consistency. Looking at clinical data, studies exploring the direct impact of increased fiber intake on creatinine levels in patients with chronic kidney disease have shown some promising, although not always dramatic, results. Some studies have indicated that higher fiber consumption, whether it's from diet or supplements, is associated with lower levels of certain uremic toxins and modest improvements in markers like creatinine, particularly in the earlier stages of kidney disease. The benefits are likely multifactorial, stemming from improved gut health, reduced absorption of toxins, and better glycemic control, all of which support kidney function. Now, incorporating more fiber into your diet should always be done gradually and safely, especially if you have kidney disease. A sudden large increase in fiber can cause issues like gas, bloating, and abdominal discomfort. It's also crucial to increase your fluid intake as you increase fiber, because fiber absorbs water. For individuals with advanced chronic kidney disease, especially those on fluid or potassium restrictions, discussing fiber sources and appropriate amounts with a renal dietitian or doctor is absolutely essential. This helps to ensure it aligns with their overall dietary plan and doesn't exacerbate any other conditions. Number 6, N-Acetylcysteine, NAC. And finally, at number 6, we have N-Acetylcysteine, or NAC. N-Acetylcysteine, commonly known as NAC, is a supplement form of cysteine, which is an amino acid. Its primary function in the body is as a potent antioxidant and as a direct precursor to glutathione. Glutathione is one of the body's most important and powerful natural antioxidants. It plays a critical role in protecting our cells from damage caused by oxidative stress and free radicals. So, by boosting glutathione levels, NAC helps to enhance the body's overall antioxidant defense system, which is particularly beneficial when organs like the kidneys are under stress. NAC exhibits potential kidney protective effects primarily through its ability to lower oxidative stress and reduce cellular damage. As we've discussed, oxidative stress is a key contributor to the progression of chronic kidney disease and other forms of kidney injury. By neutralizing harmful reactive oxygen species and supporting the regeneration of glutathione, NAC can help shield kidney cells from this damage. This could potentially preserve their function and slow the decline often seen in kidney conditions. This protective mechanism is truly vital for maintaining kidney health when faced with ongoing challenges. Evidence from various studies suggests that NAC may offer benefits in the context of chronic kidney disease and also in preventing something called contrast-induced nephropathy, or CIN. This is a type of acute kidney injury that can occur after certain medical imaging procedures that involve contrast dye. In some studies on chronic kidney disease, NAC supplementation has been associated with improvements in markers of oxidative stress and inflammation, and in some cases, a slower decline in kidney function. For preventing CIN, NAC is sometimes administered to at-risk patients. Although it's worth noting that research findings here are varied and protocols can differ. When you're considering NAC supplementation, it's very important to seek advice from a healthcare professional, especially if you have an existing kidney condition. Dosages used in studies can vary quite widely, typically ranging from 600 milligrams to 1200 milligrams once or twice daily. While NAC is generally well tolerated, potential side effects can include gastrointestinal upset. There are also some theoretical concerns about its interaction with certain medications, so medical guidance is absolutely crucial to ensure it's a safe and appropriate choice for your individual health circumstances, and of course, to determine the correct dosage. Other natural strategies and cautions. Now, beyond these specific supplements, it's so important to remember that your daily diet plays a foundational role in managing creatinine levels and supporting kidney health. For example, reducing your intake of animal protein can lessen the kidney's workload because protein metabolism is what produces creatinine. Emphasizing plant-based foods, which are typically lower in protein and rich in beneficial nutrients, can be really advantageous. And of course, staying adequately hydrated by drinking enough water is also crucial, as dehydration can temporarily elevate creatinine readings by concentrating the blood. Lifestyle adjustments are equally important. For instance, limiting physical overexertion, especially intense exercise that breaks down muscle tissue rapidly, can help prevent temporary spikes in creatinine, since creatinine is a byproduct of muscle metabolism. More critically, effectively managing any underlying health conditions that can impact kidney function, such as diabetes and hypertension, is absolutely paramount. Consistent monitoring and adherence to treatment plans for these conditions are key to protecting your kidneys. Incorporating specific foods known for their kidney-friendly properties can also be a delicious way to support your efforts. Fruits and vegetables that are abundant in fiber and antioxidants, think cranberries, blueberries, strawberries, and watermelon, can contribute to overall kidney wellness. These foods help combat oxidative stress and support digestive health, which, as we've talked about, can indirectly benefit creatinine management and kidney function. It's also vital to be aware of certain substances and practices to avoid. For example, creatine supplements, which are often used by athletes to build muscle, should generally be avoided as they can increase creatinine levels in the blood, making it harder to assess true kidney function. Unprescribed diuretics can also strain the kidneys. Furthermore, making extreme dietary changes or undertaking aggressive detox regimens without medical supervision can be quite risky, especially if your kidney function is already compromised. And finally, and this is perhaps the most important point, any approach to managing creatinine or supporting kidney health with supplements or significant dietary changes must be guided by your healthcare professional. This is especially critical for individuals with known kidney impairment or those who are at high risk. Your doctor or nephrologist can provide personalized advice based on your specific health status, your kidney function, and your overall treatment plan. This ensures that any strategies you adopt are both safe and beneficial for you. So, to wrap things up, while no supplement can single-handedly cure high creatinine or reverse kidney disease, certain nutrients and compounds may offer valuable support for kidney health when they're used responsibly and as part of a comprehensive care plan. The real key here is to focus on strategies that protect and support overall kidney function. And always consult with your healthcare professional before starting any new supplements, especially if you have or are at risk of kidney disease, to ensure they are appropriate for your individual needs. If you found this information helpful, please do share it with others who may benefit. For more evidence-based health tips and updates on managing your well-being, consider subscribing to our newsletter. We also invite you to leave a comment below with your own experiences, questions, or insights about kidney health and supplements.